Hey everybody, Pharmacist Ben here. I want to talk to you today a little bit about something called DHEA, a pro-hormone nutritional supplement, sort of. It's not really a nutritional supplement because it is a pro-hormone. That is, it is a hormone-like substance that gets converted into other hormones, particularly the hormones of youth and vigor and vitality. That means DHEA is important for muscle building, for bone building, for keeping your heart healthy. DHEA is also important for keeping the skin healthy. DHEA helps you make moisture factors and more collagen and connective tissue, keeping wrinkles at bay. And as it turns out, DHEA also has anti-fibrotic benefits, anti-fibrosis benefits. One of the ways the body breaks down over the course of the months and the years and the decades, over the course of a lifetime, is it becomes harder, it becomes more fibrotic. This condition is called fibrosis, and it can occur in various soft tissues of the body. The kidneys can become fibrotic, the female reproductive system can become fibrotic, the male reproductive system can become fibrotic, and the lungs can become fibrotic as well. I want to talk to you today about a paper that I read this morning on fibrosis in the lungs and DHEA. As it turns out, DHEA is not just a nutritional supplement, a supplement that you can use for anti-aging and for keeping your bones and your muscles and your heart strong and for improving sexual performance, but DHEA also is anti-fibrotic. That is, it will keep fibers, reduce the production of fibers, and even reverse, according to this paper, even reverse the production of fibers in the lungs. If you're dealing with pulmonary fibrosis, researchers concluded that DHEA caused a significant decrease of something called transforming growth factor beta 1, which is a fancy chemical that stimulates the production of fibers. And they finally concluded that, quote, these findings demonstrate a disproportionate decrease of DHEA in pulmonary fibrosis patients and indicate that, check this out, this molecule has multiple anti-fibrotic properties. If you're interested in using DHEA, and I suggest that everyone over the age of, say, 40 does use a little bit of DHEA, you want to use physiologic doses. That means small doses, maybe 10 to 15 milligrams a day. I do know people who are taking 50 milligrams a day, 100 milligrams a day. It's not going to be fatal, or it's not going to cause any sickness if you take too much. If you do take an overdose, you may, for guys, you may notice that your hair is starting to thin, or you may get oily skin. For women, they may notice that they're getting some facial hair or maybe some body hair. If that does occur, back down on the dose. I recommend people start with physiologic doses, which is somewhere around 10 to 15 milligrams a day. If you want to experiment, you can increase your dose maybe to 20, 25 milligrams a day, as long as you don't go into any of those side effects like breakouts or hair loss on the head in men, or hair production on the face or on the body in women. DHEA, awesome supplement. Thanks for listening, folks. We'll talk to you really soon. Bye-bye.